Good morning, everyone. This morning I'm joined by Jim Arney, who is retired Director of Revenue from the state of Maryland. Currently the Society's eyes and ears in Annapolis. Good morning, Jim.
Good morning, Sandy.
Oh, you're just looking great as usual.
Thank you, and so are you.
Oh,
Every day is a gift.
there you go. Thank you so much. Now, this week we've been very busy with meetings and we've attended multiple meetings on tax issues. And as we begin to prepare for the beginning of, can you believe it's October? Tax season is just knocking at that door.
No?
The thing is, we haven't closed the door from this year's
Exactly.
yet. So this is crazy. Well, one of the first things we want to talk about this morning is the Senate Bill 802, the Maryland Easy Enrollment Health Insurance Program that was passed into law last session. Jim, I know this has been one that you watched. Can you share some thoughts on this?
Sure. First of all, let me say that there was actually a House bill and a Senate bill that passed. There are companion bills, and both of them are the same bills. They were enrolled, so each one of them says exactly the same thing. That was Senate Bill 802 and House Bill 814.
Okay.
What this bill does, it actually required the Maryland Health Exchange, the Maryland Department of Health, and the Comptroller's Office to establish policies, procedures, and systems to establish a state-based reporting system to provide information about the health insurance status of state residents through the use of the Maryland tax return.
You know, just a real side note, you know that no other state has done this. That Maryland is actually the beacon, and that if this is successful, that other states are watching us on this. This is what I was told on Monday. So go ahead.
It will determine whether an uninsured individual is interested in obtaining the minimum essential coverage qualifies for an insurance affordability program. It will assist in enrolling an uninsured individual in an insurance affordability program and minimal essential coverage, and it maximizes enrollment of the eligible uninsured individuals so that they can reach the maximum number of uninsured individuals and try to get them enrolled in an essential health insurance program.
Now, how many people do we have a number of how many people are uninsured in Maryland, or approximate or something?
The Urban Institute estimated that there are about 360,000 Marylanders that are uninsured. And I don't know if that covers all Marylanders, the husband, the wife, and the kids, or just the primary taxpayers, husband and wife. I would imagine it's all taxpayers.
I would think so too. So that's still a pretty hefty number. So I understand their initiative here.
Absolutely.
Now you asked, how does this affect our practitioners? Well, starting in 2019, the Maryland Forum you're going to see some new questions that you must address with your client when you're sitting down with them, and you might need to look at them in your performer. You were just stating something, Jim, about how it might not affect your current clients, but some new clients. What's your thought on that?
Well, with the ACA and the individual clients having to provide the preparer with a 1095 form, those recurring clients, what their health insurance situation is. But if you have a new client that just walks in off the street or contacts you by phone or however, I would think if you provide them with a packet of material, you would want to have something in there that's similar to the forms that that's going to have to be completed on the return regarding their insurance situation and whether or not they would authorize providing the Comptroller's Office providing this information to the exchange, et cetera, so that you don't get into the preparation of the return and then reach a point where you've got to stop, pick up the phone, try to contact them, play telephone tag, et cetera. Try to get as much information as you can right up front.
Right. So we're looking at two changes on the forms, the 502 and the 502B.
Right.
So on the 502, on page 2 of the 502 of the 2019, you're going to have a question, actually 3 questions.
Right.
For one for the tax, for the primary, then the spouse, and then of course the question about the controllers. Oh, and then actually the email address.
Right.
So from where it lays out, so you're going to have to answer: do you have, as the primary, do you have health insurance? And if you don't, you have to check that box. And if you do not have it, and then you have to give a date of birth.
Right.
The same thing with the spouse.
Yeah.
Now, this is the part that I find interesting is the box to authorize the controller to take and send that information to the exchange. Now, we have a listing here of what is actually going to be shared with the controller's office.
Well, they must include their name, social security number, date of birth of each uninsured individual. That's both spouses, and on the dependent page, any child that they have or children that does not have insurance. Must include their social, date of birth, your current mailing address, email address, and phone number of individuals in your household identified on your return, and your federal adjusted gross income amount from line 1.
Okay, so that's going to be shared from the controller's office to the exchange. And as if they check that box. If that box is not checked, then nothing will be shared with the exchange. Exactly. Right. Now, the other thing is we're going to have changes on the 502B, which will be the only thing there is going to be the checkbox about the uninsured child, the dependent, right?
Correct.
But you still have to do the date of birth.
Exactly.
Yeah. So so that's important, and it was one of the big issues that they discussed in the meeting is that people just think they can just mark it and not put the date of birth on there. The date of birth is very important because that really determines the age, and there's different exchanges for the different ages. So for a younger child has a different exchange.
Correct.
And different benefits, I should say.
Yes.
And actual grants that are available to them for a younger child.
Yes.
So that's what's really important.
For example, they would also be looking for like credit programs.
Right. Exactly.
To give them credit towards their insurance. So that's why the date of birth is so critical.
Very important. Very important. So again, this is just phase 1. This is just phase 1 of the process. So so we could see more. Now the legislative session will begin April 6th. So I think I don't know what
begins.
Oh no, that will be ending April 6th.
It ends April 6th.
And it begins the next session?
January the 8th, I believe.
January the 8th. Now, what happens? You've submitted the return. Now it goes to the state of Maryland. Now the state has stated that they're going to give the information to the exchange every 24 hours.
Every 24 hours.
Okay. So then the taxpayer will receive a letter, not an email.
No email, letter.
Right. That's because of the information that's provided in that in that content of the letter.
Correct.
Okay. And that is supposed to go out within 48 hours.
Right.
And then hopefully that they'll see something in their mailbox 5 to 7 days. Because as the preparer, if it's not there, we're the one that's getting the phone call. The exchange is not going to, hey, I answered those questions. I haven't heard anything about the insurance.
Correct.
So then let's see how that works out. This is a whole new program. Let's see if this process begins properly. So again, this is just phase 1.
Right.
So phase 2 is forthcoming in 2020. So
absolutely.
So we don't even know what that's going to entail. So that's interesting.
And according to the bill, there's certain periods that reports have to be submitted to try to establish the success of the program. The work study group has to submit a report, I think, in December of 2020.
Right.
And then the exchange, I think, has to submit a report by the end of 2022 on the success of the program.
Well, thankfully, I've been appointed on that work study group. It's myself, and we have a member from MACPA, 2 members from the controller's office, members from the exchange. We have members from cash, from the Maryland Cash Campaign, from the AARP, Kaiser Permanente, Care First. So it's a very comprehensive workforce. So this is my first one that I've been appointed to. So I'm kind of excited about it, I guess.
Absolutely.
Yeah. So I'm
on cutting edge.
Cutting edge. And here we go. Here we go.
I would like to also comment. This is not the first time that the Maryland return has been used to capture insurance information.
Really?
Back in 2008, I believe it was, we had to include information for dependent children that did not have insurance. And we could not, at that time, we argued very vehemently
Mhm.
that we could not provide that information to the other state agency. So what we had to do was anyone that was captured not having insurance, they provided us with a letter, and we mailed that letter to that taxpayer. And they had to contact that agency if they wanted them to look
Really?
to look for insurance programs.
Okay, so that started in 2008. What and it lasted for how long?
I believe I would have to go back and look. It's still on the return, I believe.
Interesting.
I could be wrong, but I think that was really the genesis for the 502B.
Oh, so that's why you started adding the children on a separate form, the dependents.
I think the first year it was on the 508, but it was a very small area.
Mm.
And then we expanded it to the 502B to give them more space and so forth. So I just point out that this is not the first time Maryland has been involved with this type of program using the tax return. And it stands a reason because
Right.
it's the only annual filing that provides you with all the basic needed
Right.
information.
And that's what they were stating. That's why they're kind of excited about Maryland being on the cutting edge,
Mhm.
because this is going to be one of those things that, like I said, the other states are looking at
Yes.
possible. And so again, making Maryland look good, putting us on the map.
Absolutely.
There you go. Now the next one we're going to talk about is the new Maryland Unemployment Insurance Modernization Project called the Beacon. So again, we went to a meeting with that. That was Tuesday. And so it's working on this new system, and the whole reason for it is to improve customer service, eliminate the manual, labor-intensive processing, increase data accuracy, improve security and privacy, allow real-time data sharing, apply common technical standards, and improve maintenance and support. Now, when is this new system going to go live? Now that is the question. So right now, it's not live, and they do not believe it's going to be live. That you're going to continue doing the old form for the third and fourth quarter, and possibly the first quarter of 2020. So, but I think we do have some websites that they can share that we're sharing down in the comments section. Now, this is what I thought was interesting, Jim, that they're giving a test period. So even if even though they're not live, you can actually put some bogus data in the test area just to test it out to see how it works, and which is great. And they can do that now, and they have a unique website base for that as well. And so even though you are currently registered in your old system, you're going to have to do a whole registration process with this new modernization program. And so when we went to the meeting on Tuesday, there was, and you can help me with this, is one of the questions was, will it interact with the new hire system? So is that like a different system in the state? Do you know?
Yes.
Okay, so I have a new employee. Okay, and so what's happening? That will not automatically coordinate with this new system. It's going to be totally separate.
Yes.
And so who handles the new hire system? Where's that under? Is that under?
Probably Department of Labor.
Okay. So that's the department, and this is Maryland Employment. Okay, because I thought that was interesting. That maybe they could have coordinated a little bit better with that, but maybe not. So then again, I don't know who's going to sit there and type in 2,000 names, but the maximum of the system, if you want to manually start typing, is 2,000. Again,
that's opening up for a lot of typographical errors.
Oh yes, big time. And I thought, with everything, with our tax programs, there's that 2-level authorization. That we're dealing with the tax software. Mm-hmm. So moving to this modernization, I said, well, are you going to do this for this? And actually, they're not.
Really?
Yeah, that's what I thought was interesting. They said they're looking at it, but it's something that right now is not happening. But you do have to change your password every 90 days. So they are putting some security there. Now, this was another area of controversy during our conversations, and we had about 30 people in the class. So I have a little example here. So right now, say you owe $2,500 in Maryland unemployment insurance that you owe. And of that, $750 is from the first quarter of 2019, $750 from the second, and $100 is from penalties because you didn't pay on time. Okay. And then you owe $900 on the third quarter. I think that adds up to $2,500.
Right.
Okay. So, and you can only make a $2,000 payment. So the system does not allow you to say, from this $2,000, I want you to pay off the third quarter, and I want you to pay off first and second. It doesn't let you pick where you want to pay this off. It automatically takes the payment of the most current quarter, so it'll pay off the 900, then penalties, and then back. And that was a big issue for the people in the audience. They said, look, you know what? Because I might be fighting those penalties and I'm just waiting for a decision, but you're automatically taking my money. And now, and the penalties is for the oldest ones. So even my 2000, I'm going to have penalties again next month.
Exactly.
So this was a big issue. So I don't know if I know these town halls are going on throughout the state, but this is a question, and people really were saying, no, you guys got to look at this. This is not right. I mean, I have to agree with them. I think that's.
I agree. I know with the income tax, the law says it's applied to penalty, interest, and then the tax.
Oh.
That's in the statute.
Oh, is that right?
For income tax.
So okay, so
which is, I can see a taxpayer's point of view. All their payments are going to penalty and interest, and the principal is staying there, so they're just in a revolving door, paying interest and penalties, and penalties.
Yeah, but but I just thought with this, and that's with tax, it's a one annual. Well, I mean, you could have estimates, but but with the quarterly thing with the Maryland employment, I would really believe that you would be allowed to pick which one you're paying off.
I would think.
I know, and that it's not. It's like the payment's made. It's going. This is how it's programmed.
Wow.
And yeah, I thought that was interesting. So the next thing is, again, you do a great job during the season legislative session, keeping an eye in the ear in Annapolis and what's going on. And actually, we're having a training today in which you're going to be guiding some of our volunteers. This is how we're going to do the process, and this is what we're looking for. This is which ones we're keeping a watchful eye on. And again, I want to thank you so much for doing that for us. But we also have the federal level that we're talking about as well.
Yes.
So yesterday or Wednesday, I had my quarterly meeting conference call with the IRS that I have. And what we talk about is education requirements, how we as a corporate sponsor of offering education to EAs and the CPAs, how, what our requirements are. And it's oversight over us. And so with that, during that presentation, we learned about HR 3330. 3330. Okay. I wasn't sure if it was 330 or how we pronounced it, but so this is a new new bill, I should say, not into law, called the Taxpayer Protection and Preparer Proficiency Act of 2019. I know. I mean, who thinks of it? It's another requirement, right? So again, we after the RTRP sort of went to the wayside because of the Loving case. Now this is, and they said, anything that happens is going to have to come from legislation. And so this is actually part of that.
Okay.
And like I said, right now it's in the Ways and Means Committee, and that's where it's sitting right now. So I don't know if it's going to be showing working its way through the process, but it's something that we should be looking at, or maybe people will be keeping an eye on, and we definitely will be keeping an eye on this. So finally, always this time of year, you worked in tax, you always hear rumors like, this is what I'm hearing, this is what I'm hearing. So we're beginning to hear those rumors or some thoughts or changes. So right now, we're hearing that the Democrats on the Ways and Means Committee is looking at the SALT issue.
Okay. Good.
Define me, what is SALT? Tell me what the
state and local tax.
That's what it is, state and local tax, right? And is on the table. And so right now, for 2018 was $10,000.
Right.
Okay. So currently there is proposal legislation that we repeal that cap and raise the top income tax rate. And also that's one. Okay. And then there's also another bill to increase the SALT cap to $15,000 for individuals and $30,000 for joint filers.
Okay.
So that's another, again, just things are happening up the hill, but this is that time of year that happens. So October, December is when they start talking and debating.
Well, they just had off for the month of August, so they had time to kind of think
and then see how they can make our lives miserable.
Maybe.
Or challenging. Let's just say challenging. There we go.
Excellent.
Let's just use that word. Let's just say challenging. So So, but what we're hearing is that this change is pretty much a long shot. So I really don't know how far it's going to go, but especially with when they lowered the interest rate by a quarter%
1/4%
yesterday. I think that's because of the recession knocking at the door that he's concerned about. So we shall see. Well, Jim, I'm telling you, we've talked about a lot of things this morning, and I mean, and this is
And
just
it's
what
not
happened.
even the filing season.
I know, and this is just what happened this week. I mean, this is crazy, right? It's crazy times. So, again, Jim, thank you. I'm
Thank you.
looking forward to our training in a couple minutes. And again, it's always a pleasure to have you on the show.
Enjoy being here.
Yes,
Thank you.
yes, and you always bring some great insights. I really did not know about that whole insurance thing and then back then.
Oh.
That was interesting. So, well, I want to thank everyone for joining us this morning. Next week, I believe we're going to be talking about the Matchmaker Business Program. Oh, and I just want to leave with a couple notes. We do have, I think, 6 spots still available on the Get Us Tour on Saturday. I'm going to see you there, right, Jim?
Yes, indeed.
Okay, I'll be there with the family. And so come on out and have fun. And we have 6 spots left. And so that's going to Saturday. And that's at 3:30. 3:30 is when we have available. Also on the 27th, we have the Regulation 7216 seminar that we have plenty of spaces. Again, it was interesting. We discussed this yesterday on our monthly call with the CPR committee. And what did Chris and Al say? They said, if you don't realize how important this is,
right.
This is so important. You don't know how important this is.
Exactly.
And so you really need to come. And so we have Miles Stockbridge is going to be Megan. I forget what Megan's last name is. Will be teaching the class. So it'll be a great class. So again, we still have space available. You definitely want to sign up. And for those who are interested in buying and selling a practice, we are having the Matchmaker Business Program on the 26th, the evening of the 26th. We do have some space available left for that. That is a limited attendance at 20. So if that's something that's on your radar, 5 years down the road, we got a panel put together of people coming in and talking about what they learned in this process in selling and buying a practice.
I'm happy that you explained what matchmaking was. I thought you were getting into the dating business or something.
Been there, done that, haven't you, Jim? Come on, Jim.
Not me.
Well, thank you again for joining us this morning. It's been a pleasure. And again, Jim, thank you again.
Thank you.
And everyone have a wonderful day.